Kayla, if you can turn your camera back on, please. Thank you. All right, and remember this is class time, so make sure you're participating, okay? Need a couple more of you guys to join, please. And the link to this is under week 9 announcements, as well as the 2 PowerPoints. One of the PowerPoints has like question and answer kind of things. So looking at giving you kind of testing advice. So that one might be helpful to look at as well. And then Professor Stiles, remember she's been doing the weekly HESI reviews. And those should all be downloaded in an announcement, okay? So I'd be looking at those lectures as well in preparation for your HESI. And I think sometimes people think that the PEDS HESI is going to be really super easy, but just try not to brush it off because it's a lot of information to know. It's essentially like med surg, but for kids, okay? Alrighty, we need a couple more of you.
Yep. I couldn't get mine to go on, so I'm playing on my phone.
That's fine. You can play on your phone.
Okay.
Yep, that's fine. I don't care if you guys play on your phone.
Okay.
Yeah, Melissa, you are right. She chatted me and she said that people say that PEDS is one of the hardest HESIs. So, and I do not necessarily disagree with that. Okay. So make sure you guys are starting to study. Got 2 weeks. And if you haven't figured out what time and things you need to be doing your HESI, make sure you're checking with your campuses. Okay. If there's a time that you can sign up during our usual class time, so on Monday mornings, then that's the section you should be signing up for. But if your campus doesn't offer that time and they only offer a different time, then, you know, be checking with them and seeing what section you should be in. Okay. Alrighty, let's get started. Okay, toddler has a Broviac catheter while playing. The IV tubing disconnects from the catheter. What's your priority action? Clamp the catheter, turn off the IV pump, position the child sitting up, or flush the catheter with normal saline and heparin. Clamp the catheter, okay, because that's a central line. Okay, so you want to try to make sure that nothing's getting in there as far as air or anything. Okay. Good.
Doc, I'm sorry, is there a way, because all I see are the color squares, is there a way I could see the question and the responses too?
I'm not sure. Are you playing on your phone?
I'm playing it on my laptop.
Okay. I mean, I can read the colors and things to you too.
No. I have the corresponding colors, but that's like all. Like mine is like this.
Okay. Can you see my screen
Yes,
playing on your laptop?
on my phone. But okay,
Okay.
I'm gonna work it out.
Okay. Sorry. Yeah, I don't know
Yeah.
if there's another way. I think um unless you have a settings option in the corner. I don't know if you can change the settings on your laptop or not.
Yeah, I'll try it. I'm gonna just switch it.
Okay. Okay, an infant just had a cleft lip repair surgery. Why should you minimize crying during post-op recovery? And it's crying stresses the suture lines, right? That's going to put pressure where those sutures are on that kiddo's repair. So you want to try to do have the kiddo have as minimal crying as possible. Okay. Any questions on that? No? Okay. All right. Child has a central line for the treatment of ALL, which is leukemia. Now has a fever of 103. What is the most important intervention? Obtain a CBC, administer an antipyretic, obtain blood cultures from the central line, or take temperature every 2 hours. Okay, so it's blood culture. If a kiddo has leukemia, what are we most concerned about in those kids?
Infection.
Infections. Yep. So the way to check that to make sure that this central line is not infected is by getting blood cultures. Usually they do a blood culture from the central line, and then they also poke them separately and do a separate blood culture just from like a normal vein that's not involving the central line. And that's kind of a way that they can double check if it's actually the line that's infected or if it's the kiddos become septic. Okay.
I have a question.
Uh-huh.
It will be like this on HESI because we can give antipyretic and then obtain blood cultures. Like it's like 3 minutes later.
Yep. Yep. This is going to be your HESI and this is going to be your NCLEX as your priorities. You got to
Okay.
figure out what's most important as a nurse.
Okay.
The thing you
thank
should be doing first in these scenarios. But yep, this is HESI is going to be a lot of like, okay, all these answers are right, but what's the most important or the thing that you should be doing first?
Okay.
NCLEX is like that too when you guys go to take that. Okay. Okay. Child is scheduled for the reduction of an intussusception and passes a soft brown stool. What should you do? Make the child NPO, ask the parents what else the child ate, send the stool for analysis, or notify the healthcare provider of the passage of stool. Okay, so with intussusception, are they having stools? Not usually really having soft brown stools, right? So if they pass a soft brown stool, is it likely that that intussusception corrected itself? Yeah, so they don't need to go in and have that addressed again, okay? So that's why you'd let the healthcare provider know so they can make that decision on if they need to still do the reduction. Okay. Okay, multi-select. What foods are appropriate to introduce to an infant after they are 6 months old? Sliced beef, whole milk, pureed fruits, rice cereal, fruit juices, strained vegetables. pureed fruits, rice cereal, and strained vegetables. Okay, fruit juices, you should avoid those just across the board pretty much, but usually that's not until after 6 months of age. So like 8 months or 9 months. Okay. Sliced beef, that's not until later as well. Like after a year. Whole milk, they have to be a year. Okay. Strained veggies, that cooked veggies is ideal for kids if they're 6 months because, you know, they don't have teeth to be able to crunch those raw veggies. Okay. Okay, a mother says that her child with spina bifida sneezes and gets a rash when playing with balloons. What allergy is this? Latex, pollen, dust, or mold? Latex, good. And that goes along with spina bifida, right? They're more at risk for latex allergies because of spina bifida. Okay. So very common that those kids have latex allergies. Okay, how do you reduce an infant's risk for otitis media? Give ear infections as soon as the child has cold symptoms. Avoid getting ears wet when bathing or swimming. Have the child sit upright, position for bottles. Clean the external ear daily. Okay, you guys were kind of, okay, otitis media. What is otitis media?
Inflammation of the middle ear.
The middle ear, yep. So otitis externa.
Oh, swimmer's ear, got you. Okay.
Yep. So avoid getting the ears wet when bathing or swimming. That would increase your risk for swimmer's ear, right? Which is otitis externa, not otitis media. So having that child sit up more upright for their bottles while you're feeding them, that reduces their risk of ear infection. Okay, just because that helps with the eustachian tubes drainage. Okay. We don't want to give antibiotics as soon as kiddos have cold symptoms because they don't need antibiotics for cold symptoms, right? Okay. And cleaning the external ear doesn't necessarily do anything for otitis media risk either. That's the other thing that'll happen on HESI is they'll flip one little word and just before you guys make your choice, read the question again and then make your choice. Okay. Okay, in adolescent psychosocial development focuses on being industrious, achieving intimacy, establishing a sense of identity, or developing initiative. Establishing a sense of identity. Remember, they're trying to figure out who they are, who their friends are going to be, what they're going to do with their future, all of that. Okay. So they're in the identity versus role confusion stage. Think back to, week 1 and 2. Okay. And that's in regards to Erickson's theory, right? Okay, a 10-year-old is in the acute phase of rheumatic fever. What activity is appropriate for the nurse's plan of care? Playing ping pong, going to the playroom and climbing on a fort, reading, ambulating without restrictions. Okay, ambulating, letting them walk. So that way their joints aren't getting super swollen and stiff. Remember, because with rheumatic fever, that can affect our joints and our heart. What happens, or what causes your risk for rheumatic fever?
Strep.
Strep, group A strep. Yep. Good. Okay, an adolescent is very depressed. What finding might indicate a risk for suicide? Excessive talking, sleepiness, a preoccupation about death, or history of drug use? Yes, them talking about death or kind of being almost obsessed about death. That's more concerning. Not that a history of drug use doesn't also potentially put them at a little bit higher risk, but the biggest risk out of those options are the preoccupation about death. Okay, child is admitted with depression. What finding is most significant in confirming depression? Irritability, recent weight gain, sadness, general fatigue. Most significant. Sadness. Yep, good. Now, irritability, recent weight gain, and generalized fatigue, all of those things can be symptoms as well of depression. Okay. So just figuring out which one confirms that diagnosis the best. Okay. Why would you mix an iron supplement with orange juice to deliver the dose? The iron tastes better. Vitamin C helps with iron absorption. It looks better, or iron is activated by orange juice or food. Yes, vitamin C helps absorb iron. If kids don't take vitamin C with their iron, they're not going to absorb it fully. Okay. So essentially, they're just taking a vitamin to just take a vitamin. Okay. So they have to drink some orange juice or take some form of vitamin C with it. Okay. Plus, I do think it also helps with the taste a little bit. Liquid iron does not taste good if you guys have ever tried it or your kids have had to do it. Doesn't taste good. Okay, what would you expect to see when assessing a child with impetigo? Small brown benign lesions, soft wet serosanguinous blisters, honey-colored crusted lesions, or circular lesions? Okay, honey-colored crusted lesions. Okay. Any questions about those? That's classic impetigo. Okay, they might have a little bit of a bump. It's usually not a blister. Okay, so it's not a vesicle, usually. And then they very quickly become crusted and they're always honey color. Okay. Okay, school nurse with an asthma attack patient, he cannot talk, is cyanotic, decreased shallow breathing. What's your priority? Monitor the child with a pulse ox, prepare to ventilate the child, call the parent or guardian, send the child back to the classroom. Okay. So with a kiddo who can't talk, is already blue and having decreased breath sounds, do you think at that point the pulse ox is that helpful? No, right? Because you can tell that that kiddo's not oxygenating, right? So the pulse ox is going to be low if you throw that on them, right? So the thing to do in this scenario is get ready to ventilate the patient. So you're going to get ready to breathe for the patient with a bag or a mask, okay? Not that a pulse ox isn't helpful eventually, but the very first thing you should be doing is preparing to breathe for that kid. Okay? Questions about that one? No? Okay. Okay. Infant develops arm, leg movements before fine motor finger skills. This is an example of which type of development? Cephalocaudal, proximal distal, extremity movement, or pedal movement. This is way back to week 1 too. Proximal distal. Yep. Because they're getting their closer to their body, so their arms and their leg movement, general movements, before their fine finger and toes, you know, skills. Okay. Any questions on that one? No? Okay. After a cardiac catheterization 2 hours ago via right femoral artery, which finding indicates an arterial obstruction? Blood pressure trending down and increased heart rate, distal pulse on the left foot weaker than the right foot cool, pale, blanched, pressure dressing wet with blood. Okay, yes. So the right foot is cool, pale, and blanched, right? Because if there's an obstruction in that right femoral artery that they went into for the cardiac cath above the right foot, right? Because it's in the groin area. So if there's an obstruction above the right foot's not going to get blood flow. So you're going to have decreased pulses. You're going to have, you know, cool, pale color changes. Okay. So that's going to be a sign of an arterial obstruction. And this, you know, this blue question threw you guys off. Distal pulse on the left foot weaker than the right. It would be the opposite, right? Since they went in through the right femoral artery, it'd be distal pulse on the right foot would be weaker than the left. Okay. Okay, toddler with a spica cast from a motor vehicle accident wants a toy. Which toy is most appropriate? A squeaky duck, a handheld video game, dolls and clothes, soft hand puppets. It's kind of all over the board on this one, isn't it? So, because they're in a spica cast, you have to think about toddler age group. So soft hand puppets would be the best option. Handheld video game, toddlers shouldn't be using screens. Okay. Dolls and clothes, they're a toddler. So think about pieces of the doll. Okay. And a squeaky duck. A lot of times those squeaky ducks, they have small parts that make them squeaky, right? That toddlers could potentially get into and swallow. Okay. So soft hand puppets, that's the most appropriate toy for a toddler.
Oops.
Okay, an infant with tetralogy of Fallot suddenly goes cyanotic and hyperypnic. What's your priority action? Place the child in a knee to chest position, apply 100% non-rebreather mask, give IV fluid bolus, or administer morphine. Yes, knee to chest, right? Because they're having one of their TET spells. And knee to chest, what does that do? Does that increase or decrease blood venous return?
Increase.
Yes, good. Okay, child with DKA has Kussmaul's respirations. This is a compensation mechanism for what acid-base alteration? Metabolic alkalosis, metabolic acidosis, respiratory alkalosis, or respiratory acidosis. Metabolic acidosis. They're having those respirations. So that people get confused a lot about this one because you hear respirations, right? So you think respiratory, but they're having those respirations because they're in DKA. So because of their diabetes. Okay, so that's what makes it metabolic acidosis. And they're breathing off that CO2. Okay. So just because there's a reference to respiration does not automatically make it a respiratory type. Okay. Okay. Child is admitted with persistent vomiting, an NG tube is inserted. What finding should be reported to the provider? Gastric output of 100 mils during previous shift, intake of 800 mils and output of 400 mils, pH of 7.44 on blood gases, arterial blood gases, or serum potassium of 3.1. Okay. So what do you worry about with vomiting? Or what happens usually to kids if they're vomiting?
Well, dehydration.
Imbalance.
Yes, they become dehydrated and they get an electrolyte imbalance. So a potassium of 3.1 is showing you an electrolyte imbalance starting, okay?
What are the potassium levels for kids?
So it's usually 3.5 to 5
Okay.
is the range. So just a little bit low on that one. So this kiddo would need some potassium. Probably just add it to their fluids would be my guess. Okay. Yeah, but 3.5 to 5, which is actually the same range as adults. Okay, which foods are appropriate for a child with celiac disease? French toast, rye crackers, garlic bread, creamed corn. Creamed corn. Good. Rye crackers have wheat in them still, have gluten, okay? So no rye crackers. Okay. Okay, mom hides a toy under an infant's blanket. The infant looks for the toy. What is this called? Object permanence, cooperative play, object prehension, or separation anxiety. Object permanence. Okay, remember? And that usually happens around how old? Do we remember what age?
Is it like 2 to 3 or something?
No, 9 months.
Oh, okay.
Yep, around 9 months. Okay. So infants. Okay. Any questions about that? Okay. All right, well, measuring head circumference of a 3-month-old infant, the nurse noticed an increase of 5 inches. What's your next action? Measure head to toe length, palpate the fontanelle for firmness and bulging, place the findings on the growth chart, or check pupils. Yes. Okay. Palpate the fontanelle for firmness and bulging. What could be going on if there's been that big of an increase in head circumference?
Swelling.
Yes. Good. So hydrocephalus, right? That could be happening. Could be getting fluid on their brain. They could have an infection like meningitis or encephalitis, right? That's making their fontanelle bulge and kind of push out with fluid and increasing their head circumference. Okay. Good. You would also check their pupils, right? But the first thing you should check is their fontanelle. And remember, how do we check fontanelles? Do we just check them with them laying down flat?
Sitting up.
Yes, they have to be sitting up when you check them. Okay. Okay, a 3-month-old with GERD has lost weight from the last appointment. How can you increase calories and decrease vomiting? Small frequent feedings, offer high sugar juices with feedings, start baby food with each feeding, or thicken formula with cereal. Okay, so with GERD, yes, small frequent feedings is probably more ideal if you're concerned that they're being overfed. But if they're losing weight, then you have to figure out a way to get them more calories, which is adding the rice cereal to their feeds. Okay. Also, by adding the rice cereal, a lot of times they don't have as much liquid to just kind of reflux back up. Okay. Okay, what is the most important reason for implementing discipline for infants and toddlers? Child needs to learn to deal with authority. They provide the child with a sense of security. Children need help developing social skills. This age child fears loss of self-control. Yep, they provide the child with a sense of security. Good. A newborn is noticed to have hypospadias. The parents want to know when this should be repaired. The repair is done within the first month of life to decrease UTIs. It's delayed until school age because of castration fears. Should be done when the child is sexually mature, typically done before potty training. Yes, done before potty training. What is hypospadias?
Is that when the hole is not at the tip?
Yeah, the urethral
I don't know if
meatus.
it's below.
Yep, good. Do these kids get circumcised?
No.
No.
No, right? Because they use that extra foreskin to do the repair. And then they can do the circumcision if parents want to do that after. Okay, good. Okay, what would be the drink of choice for a child with sickle cell disease on a hot summer day? Milkshake, Diet Coke, lemonade, iced tea. Lemonade. Okay, why not iced tea?
Who
Is it
made them?
because of the sugar?
It's diuretic.
It's too much sugar.
Has caffeine.
Yep, it has caffeine. It's a diuretic. There may be too much sugar. There's a lot of sugar though in lemonade too, but the biggest thing is caffeine, right? Because caffeine is a diuretic. Okay. Good. Okay, multi-select. An infant with diarrhea is lethargic. What assessment findings would be consistent with dehydration? Tachycardia, prolonged capillary refill, decreased blood pressure, increased urinary output. And remember, it was multi-select. Okay, good. Yeah, tachycardia. That's going to be one of your first signs in kids, especially infants, that they're starting to get dehydrated, even before the prolonged cap refill. Okay. Low blood pressure. Okay. And then longer cap refill. Okay. And obviously it would be decreased urinary output, not increased. Good. Okay. Chinese child just finished treatment for pneumonia. You notice round bruise-like blemishes on the chest. What's your nursing action? Look at the antibiotic use, report suspected child abuse, ask the child if they had an accident recently, and or inquire about alternative methods of treatment. Yes, so those round bruise-like blemishes, what in the Chinese culture is fairly common? To
Like they place like this suction bottles.
Yep, cupping,
It's
right?
not only in Chinese.
Yep, cupping. It came from the Chinese culture though originally, but yes, cupping is very common. So, which is the suction cups, okay? They sometimes heat them up and then apply them, okay? So you'd want to ask about if they're doing any alternative methods first before you jump to reporting them for suspected child abuse or asking them if they've had an injury, okay? Or looking at the antibiotic. That's going to be more of like a rash versus round bruise-like blemishes. Okay. Good. Okay, which statement indicates understanding of the mode of transmission of Lyme disease? I have to wear long sleeves and pants when I'm hiking around a pond. I will cover my mouth when too much dust is blowing. Need to wash cuts and scrapes right away. I will not swim in still water. Yes, long pants and long sleeves. Because what does Lyme disease come from? What starts Lyme disease?
Ticks.
Ticks. Yep. So you want to try to avoid those ticks being able to attach to your skin. Good. How can you prevent diaper rash on a 4-month-old? Use a generous portion of baby powder. Use a cloth diaper instead of a disposable for overnight. Wash diaper area with soap and water every 2 hours. Use a barrier cream that does not completely need to be removed each change. Yes, barrier cream. So something like Desitin, you know, it's that really thick, it really adheres to their little bottoms. So you want to make sure that you get them clean, but you're not wiping until all that Desitin's off. Okay. But a barrier cream is the best way to prevent diaper rashes. How do you evaluate the effectiveness of thyroid therapy in a 5-month-old infant? They're turning from their abdomen to their back and cooing frequently. They're lifting their head but not rolling abdomen to back. They're using reflex grasp. They're not cooing or making noise. Okay, so turning from their abdomen to their back and cooing frequently, because that's things that a normal 5-month-old should be doing, right? So if they are getting the right treatment for their thyroid, they should be meeting their milestones appropriately. Okay. So lifting their head but not rolling abdomen to back, they should be doing that by 4 months, rolling. Okay. Abdomen to back at least. Reflex grasp, that's a infant reflex, so that doesn't necessarily mean anything for thyroid effectiveness. And not cooing or making noises, babies should be cooing or making some sort of noise usually by 4 months. Okay. Okay, a 3-year-old child with congestive heart failure, pulse is getting slower and slower over several hours. What else needs reported immediately? An oxygen saturation of 94%, urine output of 20 mils per hour, respiratory rate of 24, or a blood pressure 70/40. Blood pressure 70/40, because that's decreasing as well. Okay. Good. Oops. Oh gosh, hang on a second. Can you guys still see my screen? Yeah. Okay. Okay, a toddler needs an LP for possible meningitis, which is a lumbar puncture. Okay, which teaching should the nurse provide? Describe the side laying knees to chest position for the procedure. No restrictions once the procedure is done. You may hear clicking noise the whole procedure. Nothing to eat or drink for 8 hours after the procedure. Yes, positioning. So tell that kiddo how they're going to have to lie. Okay, good. Okay, parents want to have more children after their one son was diagnosed with Duchenne's muscular dystrophy. What's your reply? Duchenne's muscular dystrophy is caused by a viral infection. The XXX muscle group has a lack of protein dystrophin from the mother. Birth trauma caused the muscle weakness. DMD is inherited X-linked recessive disorder that affects males. Yes, good. So it's X-linked recessive, okay? So every male that has that will be affected. So if they have another son, then they're going to have Duchenne DMD, okay? Good. Okay, you find a child unresponsive with a pulse, you yell for help. What action should the nurse take next? Check pulse, give 2 breaths and make the chest rise. Deliver 30 compressions and 2 breaths. Feel for the carotid artery and check for breathing. Okay. So this is CPR, okay, right? We checked for a pulse already, so we don't need to check for a pulse again. Don't need to find the carotid artery because you've already used that to check for a pulse. Okay. So first you breathe. Okay. Then you start your compressions. Questions about that? No? Okay. Okay, what type of play would you expect to see when 2-year-old children are playing? Associative play, cooperative play, parallel play, or therapeutic play? This is way back to week 1, too. Parallel play, good. Tell me what parallel play is, remind me.
They're side by side, but they're not playing with each other.
And there may not even be playing with the same kind of toy, right? They're not playing with each other, they're not talking to each other, they're just doing their own things, but they're next to each other. Good. Alrighty. Those of you guys who want to stay on, we can keep going. But now it's 11:25, so you guys are able to hop off if you'd like. So, does anyone want to keep going? Yes, no?
Yeah. I mean, to finish the set. Or,
Yeah, there's like 15 questions left, I think.
yeah.
So we can finish them if people want. Want to finish them? Okay. We'll keep going. All right, an adolescent with type 1 diabetes checks his blood sugar before bed and it's 60. He ate 4 hours earlier. What should you do as a nurse? Bedtime snack of graham crackers with peanut butter and milk. Have him go to sleep. Give him glucagon, or glucose levels are unreliable because he did it himself. Yep, give him a snack before he goes to bed, because what's going to happen as he lays there and he doesn't eat for longer?
Go bottom out.
Yeah, and he's already at 60, which is kind of the low range of normal, right? Good. Okay, a 4-year-old with an NG tube states, I'm going to throw up. What should the nurse do? Notify a physician, have the mother calm the child, give an antiemetic, or irrigate the NG tube to maintain patency. Yes, irrigate the tube. Okay, because a lot of times if they get that sensation that they're going to throw up, a lot of times there's a clog in the tube. Okay. Also giving them something so that way they don't feel like they're going to throw up. But the thing about the NG tube is it goes in the back, it goes past in the back of their throat. So sometimes if kids have a big gag reflex, it's going to be irritating to their gag reflex no matter if they're on an antiemetic or not. Okay. Because that doesn't change the fact that the tube's in the back of their throat. Okay. Okay, what foods should you restrict from a child with complete renal failure? Meats, dairy products, carbs, fats. Complete renal failure. Meats, yes, because they're harder to break down for the kidneys. Okay, good. Okay, signs of meningitis in an 8-year-old child include what? Colon sign, Kernig's sign, Koplik spots, or Chevsky's sign? Kernig's sign. So this is when you have the child laying flat, okay, and you bend one of their legs and the other, they kind of pull the other leg up at the same time you're bending the leg that you're working on bending. Does that make sense? So you bend their leg for them, the other leg bends as well at the same time. That's a positive Kernig's sign, which is suggestive for meningitis.
I'm sorry, is that like one of the reflexes?
So that's
Okay.
suggestive of, it's not a reflex. That's not something that should normally happen. That's a kid that has meningitis. That's going to happen. So
Okay.
it's suggestive of meningitis. But it's not like a normal, like routine newborn reflex or body reflex. Okay. Okay. Child received an irreversible head injury after being struck by a truck. Who should approach the family for organ donation? Nurse manager, the emergency department nurse, transplant coordinator, or pastoral staff member? The transplant coordinator, right? Because they're the person that kind of is aware of who needs what potentially, and that's their sole job, is doing dealing with organ donation. Okay, good. Personal protective equipment for a child diagnosed with severe acute respiratory syndrome includes gloves, gown, that should say gloves, not clothes, gloves, gown and mask, gloves and gown, gloves, mask, eye goggles, or eye shield. So gowns, gloves, mask, plus eye shields or goggles. Okay. Because if they're coughing and it's droplets, that could get in your eye potentially, right? They could sneeze in your eye. So that's why you need the goggles as well. Good. What finding would you see with a child with celiac disease? A concave abdomen, a protuberant abdomen, bulges in the groin area, or a large abdominal mass? A protuberant abdomen. So that means their abdomen is kind of stuck out and descended, right? And then their buttocks, remember their glutes, they're going to be kind of less muscular. Okay. Good. Okay, a 3-month-old infant just had cleft lip repair. To prevent trauma to the surgical site, the nurse should give the infant a pacifier for self-soothing, place the infant's arms in soft elbow restraints, place the infant prone, avoid touching the suture line even to clean. Place the infant in soft elbow restraints, okay? Because infants, a 3-month-old, they're at the age where they're, starting to find their mouth and things. So you don't want them touching the suture line. You still need to clean the suture line. You may also need to apply, if it's more external, you may also need to apply some antibiotic ointment or something like that over the top of it. So you'll still have to touch the suture line. to do things like that. Okay. Good. Couple more questions here. How do you assess fontanelles on a 4-week-old infant? Supine, left lateral position, prone, seated, upright. Seated, upright. No matter their age, sit them up. Okay. Support their neck and things as you sit them up, but you'll still have to sit them up to assess their fontanelle. Good. 13-year-old girl is evaluated for possible Crohn's disease. The nurse expects to prepare her for which diagnostic study? Genetic testing, myelography, cystoscopy, or colonoscopy with biopsy. Colonoscopy with biopsy. Okay. Good. 2 more. What complication of carbamazepine or Tegretol is prevented by weekly blood tests? Bone marrow suppression, leukopenia or sore throat, meningitis, or a GI bleed. And I'll just be honest with you guys, Tegretol is almost never used any longer because of this risk. So it can suppress the bone marrow stimulation. Okay. So they have to do labs every week to check for that, like CBC. Okay. What signs and symptoms should the parent of a child with congestive heart failure report to the healthcare provider? Fever, sudden weight gain, vomiting, headache. Sudden weight gain because they have congestive heart failure. So what does that tell you if they gain weight suddenly?
That they're
Fluid
retaining fluid.
retention.
Yep, fluid retention. Good. Yep. So their heart's having to work harder. Good.
So
Last
Ms.
one.
Becker, I have a question. Oh, sorry.
Multi-select. So which instruction should the nurse reinforce to a parent with a child who has an application of cast for a fracture of the right ulna? Call the healthcare provider if the nail beds appear blue or pale. Wiggle fingers frequently. Keep the arm elevated. Take Tylenol for pain. And this was a select all that apply. And then you can ask your question. Okay, it was all of those things. Okay. So parents should be taught about pain management for these kids, having them wiggle their fingers, see if they can touch, feel them touching, look at their pulse, their color of their fingers, pulses, if they can check the pulse, which a wrist cast, it's really hard to be able to check the pulse. And then keeping the arm elevated so that way it's not having too much swelling. Okay. All right. What was your question?
So I wanted to go back to that one with restraints because I feel like you guys like embed in our head, don't restrain, even though we want to keep them safe.
But with an infant who just had surgery on the cleft palate and something so sensitive, infants, you don't want them messing with the suture lines at all. So that is like the one exception to the restraint rule.
Okay.
Basically, every kiddo who has a cleft palate repair or cleft lip repair or something like that, they're going to be in elbow restraints. The other, peds is kind of an exception to a lot of things with restraints, because also if kids are, yanking at their IVs all the time too, you'll see their good arm potentially get put in a soft elbow restraint. It's not like wrist restraints or like mitten restraints because they're combative or things like that. It's usually just the elbow restraints. Okay. All right. Any other questions? No? All right. You guys have a good day. Be studying for your HESI. Doing
Thank
the
you.
practice questions and all of that, okay?
Sorry.
you guys-
Thank you.
See you later.